Mr. Speaker, whereas international leaders and experts were meeting in Toronto to talk about maternal health, gender equality, autonomy, women's health and rights must also be at the heart of the discussions. Women who have access to all reproductive health services are in better health, are better educated, and contribute more to their economies. Mr. Speaker, will the summit address women's or gender equality and reproductive health as key elements to reduce women's and girls' mortality? The Honourable Minister. Mr. Speaker, this summit from the 28th to the 30th of May in Toronto under the Prime Minister's leadership will be a vital one. We know that since the initiative in '98, a lot of the funds that have been dispersed have produced terrific results, but we can go much farther. We know that under the Prime Minister's leadership, Mr. Speaker, Canada will reaffirm that the main priority for Canada is maternal health and children's health.
Mr. Speaker, the reality is too many women are dying around the world from easily preventable causes of death. Every year, 47,000 women die, and 5 million more are permanently damaged by unsafe abortions. Women who have access to the full range of reproductive services are healthier, better educated, and contribute more to their economies. Will the upcoming summit address women's equality and reproductive choice as a key part of reducing the deaths of women and girls around the world?
The Honourable Minister of International Development.
Mr. Speaker, there will be a very important summit in Toronto from May 28th to 30th under the leadership of the Prime Minister. We can be proud of this, Mr. Speaker, because our G8 Muskoka initiative on maternal and child health will save the lives of 1.3 million children and newborns, as well as more than 60,000 young mothers, Mr. Speaker. So we have to continue to keep on track, Mr. Speaker, and with this summit we will make sure that Canada say loud and clear that this is the top main priority for the next years to come, Mr. Speaker.
Mr. Speaker, the World Health Organization has identified 5 solutions needed to save more lives, including access to safe abortion services. Experts say that unsafe abortion is the most easily preventable and treatable cause of maternal death. So will Canada ensure that the next phase of the Maternal Health Initiative is based on sound scientific evidence and not ideology? Will it include reducing the number of unsafe abortions that is putting women's lives at risk around the world?
Mr. Speaker, each Canadian can be proud because we reached a lot of good results, Mr. Speaker. And if I go, globally over 700,000 more children lived to their 5th birthday in 2011 than it was in 2010. And in over 125 countries, maternal death rates have declined sharply in the past 5 years. Between 2010 and 2013, an estimated 2 million deaths from disease have been prevented, and 5 million children have been treated by vitamin A. Thousands of women have received antenatal care. Mr. Speaker, we can be proud of this, and under the leadership of the Prime Minister, we will keep on track on this.